Hi folks, this is Dr. Cameron MacEwen of Tri-Town Chiropractic Offices in Foxboro, Massachusetts, and I'm here to talk to you today about a condition called piriformis syndrome. And this is, in my opinion, a very overly utilized diagnosis and leads to a lot of confusion in the proper treatment and management of buttock and posterior leg and lower extremity pain and symptoms. So Dr. Yeoman described this condition first back in 1928 as a cause of sciatica. And basically the symptom pattern is pain in the buttock and or radiating in the posterior thigh and leg. At that time it was considered an advancement because there was little other explanation for sciatica. We didn't have MRI and other imaging techniques to show us the other causative factors such as disc derangement and fractures and tumors and whatnot. So the diagnosis was used quite a bit with the lack of that knowledge. With research and the advancement of imaging such as MRI scan and ultrasound and other testing, it has become apparent that this diagnosis is even more nebulous than previously thought. So review of medical research and analysis of the various studies that are out there find that the diagnosis of piriformis syndrome is actually overutilized and mistakenly used for the diagnosis of buttock pain and or posterior thigh or leg pain or symptoms. So that means we're missing the true diagnoses by focusing on piriformis syndrome, and this leads the clinician to administer the wrong treatment to the painful syndrome and miss the proper treatment and the proper tissue that is generating the symptoms. So the piriformis is a muscle in the buttock. It's so this chart shows this side over here, the gluteal muscle, and on this side here the gluteal muscle has been cut away and peeled away, and there's this little group of muscles underneath, one of which is the piriformis muscle, but there are several other muscles in there that are possibly just as guilty as the piriformis, such as the gemelli and the obturator group of muscles. So this brings us to the concept of, what is the pain generator or the symptom generator for this condition of buttock pain and or lower extremity pain, numbness, tingling, paresthesia. And there are at least 10 other anatomical structures that could be responsible for the same symptoms that people commonly blame on piriformis syndrome. Those being spinal joint dysfunction, sacroiliac joint dysfunction, lumbar disc derangement, disc herniation, disc bulge, facet joint inflammation or facet syndrome. That's the inflammation of the little joints in the spinal column, spinal stenosis, and of course tumors and infection, and let us not forget the other smaller and larger muscles in the gluteal region that could be producing the same symptoms blamed on the poor little defenseless piriformis muscle. So as you can see, that's just a list of a few of the possible pain generators for this pain syndrome, and it really drives home the need for clinicians and examiners to identify the true pain generator for this condition and arrive at the proper diagnosis and formulate and deliver the appropriate treatment plan. I would love the opportunity to help you with your buttock and/or posterior thigh symptoms, whether it be truly piriformis syndrome or just something else, as we've described. To sum up, I think that piriformis syndrome does exist, but it's very rare and overly diagnosed. And an accurate understanding of the anatomy and the pain generators and the specific patient complaints, signs, and symptoms, and physical exam are vital to arrive at a proper diagnosis and treatment plan. So you can reach me at 508-698-0688, and you can email me at drcmcewen@tritowncchiropractic.com. Thanks for listening. Talk to you soon.